Well, tonight, COVID is back on the move in the wrong direction in Ohio. After a long plateau, we are starting to see another uptick. Today, we saw more than 2,400 new cases and a positivity rate of 3.8%. Now, both of those numbers are a spike from what we saw just yesterday. The question is, how high will they go? Thanks for joining us at 6, everyone. I'm Yolanda Harris.
And I'm Andrew Kinsey. After 6 weeks of seeing declining cases of COVID-19 in Franklin County, tonight, the health commissioner for the city of Columbus says she's seeing a disturbing trend.
10 TV's Kevin Landers is live outside the city's mass vaccination center to explain the concern. Kevin?
Well, good evening. Not only are cases going up in Franklin County, so is the positivity rate. Last week we were at 3.5%. Today we're at 4.1%. So the question is, why are cases going up when more people are getting vaccinated? At the city's mass vaccination clinic at the Ohio State Fairgrounds.
Yeah, I was very excited to get my shot. It's my first shot. And hopefully, next couple of months things can start getting a little bit back to normal.
Those getting their first or second shot are feeling hopeful again.
I've never been so excited to be stabbed or get a shot. Like usually I dread it for my flu shot every year.
I like to see friends and hug my mom.
While more Ohioans are getting the shot, the state is also beginning to see an increase of COVID-19 cases.
I think there are many people who think once they get fully vaccinated, they've got a ticket to do whatever they want to do. And that's not the case. It's very clear that even once you're fully vaccinated, you still need to wear a mask when out in public.
Ohio saw another spike in cases Tuesday with 2,458 cases reported. That's 968 more cases than the day before, but below the 2,700 cases we saw on the 26th of this month.
While we are seeing some increase after a dramatic period of improvement, I think we're actually doing pretty well.
Dr. Vanderhoff says these spikes are typical for the virus. Every 90 to 100 days, it tends to infect more people. Dr. Roberts says we're helping it.
People have fatigue, COVID-19 fatigue. They're not following the guidance as much as they could be. And in addition to all of that, many people have started to travel for spring break season.
Cases in Ohio stand at 140 cases per 100,000 population, but it will be higher come Thursday as cases have risen.
It's likely going to land right around 160. That is an increase, but that's nothing compared with the mid 800s that we were at when we were at the peak of the last surge.
But the higher the cases means Ohio is further away from reaching 50 cases per 100,000 people. The governor says that will trigger the removal of health orders. Moving them now, says Dr. Bruce Vanderhoff, would be a mistake.
This battle is not over. We are still in the midst of the race, and until we get across that finish line, I don't think we can afford to drop the masking and distancing that the orders call for.
Now, Dr. Roberts says in Franklin County, the age group where we're seeing the most cases are those between the ages of 20 and 29. Now, she says many of those people have yet to get their vaccines because it was just open this week for those 16 and older. She says once this group gets vaccinated, she's likely says we're going to see a dramatic drop in the number of cases. Reporting live from the Ohio State Fairgrounds, Kevin Landers, 10 TV News.